Hello everyone and welcome to sqadia.com. I'm your educator Dr. Ali Imran and today's lecture is on Uroradiology part 1. In this lecture we will be studying about male and female urinary system and the male genital system, though we will be studying about the female genital system in a separate lecture. So to outline this lecture, we will be studying about the trauma to the urogenital system. Now, which trauma leads to no imaging, which trauma leads to the selection of a radiograph, what kind of trauma leads to the selection of a contrast enhanced CT scan, and which kind of trauma leads to the selection of a fast exam or a cystograph or a urethrograph. So we will be studying about all of these modalities, their selection, their choice, and in which scenario, which one is preferred, and what advantages which modality has over the other one. Then we'll be studying about renovascular hypertension. Now, essential hypertension is treated medically, but an hypertension of renal origin, whenever suspected, is always confirmed via imaging. Now, how it is done via imaging, which conditions lead to renovascular hypertension, how we can diagnose it, which modalities are used, which phases of the CT scans are used, what is the difference between an CTA or an MRA, or certain unorthodox techniques such as the ACE inhibitor, sonography, or the injection of carbon dioxide in the renal artery. So we will be studying about all of those and much more. Then we will be studying about the acute onset flank pain, that what causes an acute onset of pain in the flank region, what is the renal colic, why the renal colic occurs, at which site, what kind of calculi takes place, what kind of modalities we use, which is preferred, which is not preferred, which is the gold standard for the diagnosis. So we will study all of that along with its interventional treatment. Then we'll study about acute scrotal pain. Now, for acute scrotal pain, it might be of traumatic origin due to some inflammation, or it may be due to some kind of mass. Now, which conditions lead to scrotal pain, which inflammatory diseases can lead to such pain, we'll study about all of those. We'll study about which kind of modalities to use, what is the difference between a normal ultrasound, a Doppler ultrasound, and a duplex one, and how we can use these to differentiate between an epididymitis or a testicular torsion. Next, we'll be studying about the scrotal masses. Now, how are they categorized? What is an extratesticular mass? What is an intratesticular mass? Which one is benign and which one is malignant? And how they are interrelated, and what is the role of microlithiasis in the development of either benign or malignant diseases. So we'll study about all of these and much more in the part 1 of the Uroradiology. You can find thousands of medical lectures on sqadia.com on a variety of topics, from biochemistry to physiology to gastroenterology to pathology. Please do subscribe to sqadia.com and you might even get a free trial period. Now, thank you so much for watching sqadia.com.